experience, and wisdom. Thank you. Over to you, sir.
Yeah, thank you, Sanskriti, and thanks to Symbiosis Institute for give this opportunities. Before I start my presentation, can I want when we say for the quality, what is the quality? Quality is the very simple term: right work at the right time for the right clients by the right provider at right place is known as quality. It's just a general term, but when we say for the health specific like the standard environment include the infrastructures, include the manpower, include the instrument equipment, but each and everything is there, but behavior is not there, then again a question mark. So standard environment is also include the behavior, the standard environment, then the standard treatment according to the standard treatment guidelines, and last but not least, satisfaction for both provider as well as clients is known as quality. अगर सबसे सिंपल भाषा में बोलूं कि जो आपको चाहिए वो दूसरों को दो, दैट मीन्स क्वालिटी, नथिंग मोर देन दिस. बिकॉज एज ए पेशेंट व्हाट इज योर एक्सपेक्टेशन? अगर हम खुद एक पेशेंट हो तो हमारा एक्सपेक्टेशन क्या होगा? एंड दैट्स व्हाई आई ऑलवेज से जो आपको चाहिए वो दूसरों को दो, दैट मीन्स क्वालिटी, नथिंग मोर देन दिस. तो वी स्टार्ट दिस प्रेजेंटेशंस. आर यू सी दिस presentation?
Yes, sir.
Yes, sir. It is visible,
Yeah,
sir.
it's visible. So before we start this presentations, as you yeah, if you are the patient, how many expectation you have? 90%, 95, 96, 98, 99 or 99.9? It's very simple, because if your expectations or accept 99.9, then you thinking your heart fell to it about 32,000 times each year. मतलब आपको एक साल में 32,000 बार जन्म लेना पड़ता है. If you accept 99.9 quality, your 19,000 babies are dropped by the doctor at the ward. If quality is accept for 99.9, 20,000 wrong drug prescriptions made every year is quality accept 99.9, and about 500 surgical operations are performed wrongly every week. If we accept 99.9, and the very important things, if God cannot think for the quality, then what happened? There is only 1% difference in the DNA genetic code between the chimpanzee and human beings. If God cannot think for quality, then each and everything is just like a chimpanzee, because the 99% of the DNA is the same as a chimpanzee and human beings. Only the 1% difference can change the chimpanzee and human beings. And that's why quality is very important, because in the healthcare sectors, one error can cause morbidity and mortality, and there will be no second chance. It's very important, there will be no second chance. अगर किसी एक गलती से किसी की मौत हो जाती है तो हम उसे वापस नहीं बुला सकते. And that means health need 100% quality. And again I say, quality is coming only from your heart. It's never come that pressure, ऊपर वाले ने pressure डाला, quality आ गई. It's just like a feeling. If you realize that you provide the quality, then you 100% provide the quality. If you don't realize that you don't provide the quality, then it's never you provide the quality. And that's why I always say that it's coming from your heart. And it's a teamwork. It's never achieved by a single person. If surgeon do best surgery, but housekeeping is not proper, you can't prevent the infection. If nursing is not proper, you can't cure. If pharmacist is not proper, you can't cure. And that's why it's a teamwork. It's never achieved by a single person. And one is important thing is the self-assessment is the best assessment for the improvement. एक बहुत ही सिंपल सा क्वेश्चन है, अगर मैं ये पूछूं कि आप लोगों में क्या कमी है, अपने आप में क्या कमी है, तो लिस्ट बहुत छोटी होगी. लेकिन अगर यही क्वेश्चन पूछा जाए कि दूसरों में कमियां क्या हैं, तो लिस्ट बड़ी हो जाती है. लेकिन क्वालिटी, if you want to improve the quality, I think self-assessment is the best assessment for the improvement, because You know your threat, you know your strength, you know your weakness, and you know your opportunity. And that's why I always say that self-assessment is the best assessment for the improvement. And mainly for this self-assessment, in the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, we initiate 3 layers of the accreditation process. We are mainly focused on the self-assessment first. We initiate the bronze quality certification, for the silver quality certification, and gold quality certification. Starting from the bronze, silver, and gold quality certification, the self-assessment is the most focused point of the self-assessment quality initiatives. If you properly self-assessment and give the evidence, it's totally online basis. If you give proper evidence after the self-assessment, which is a desktop assessment done by the qualified assessors from the Quality Council of India, if desktop assessment is completed properly, in the gold and silver certification, the certification issue, but in the bronze quality certifications, the on-site assessment is also there by the Quality Council of India. If you thinking the bronze quality certification is just a first step, because after we see that NABH entry level, NABH full accreditation, NQAS or JCI standards, but most of the hospitals cannot reach up to the NABH entry level also. And especially we focus on the tier 2 and tier 3 cities in the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So then we thinking for the quality, how we achieve quality in tier 2 and tier 3 cities. And that's why we start just minimum level of the quality standards like the bronze quality certifications. Bronze quality certification is just lower than the NABH entry levels. If your hospital is not NABH entry level, NQAS or JCI, you directly go from the bronze quality certifications. And it's bronze quality certification is the minimum standard and which easily achievable if you focus mainly on the self-assessment toolkits. And again, the silver quality certification and gold quality certification is just a change of the nomenclatures. Like if your hospital is NABH entry level or NQAS certified hospitals, you go for the silver quality certification. If your hospital is NABH full accreditation, you go for the gold quality certification. The question is mostly silver and gold quality certification, only the 25 questions, which is mainly focused on the Ayushman beneficiaries, like the IC material is available or not, your staff is trained or not, your patient care is proper or not. And this just like online, if you give the proper evidence, then the desktop assessment is done by the Quality Council of India assessors. After the desktop assessment in the silver and gold quality certifications, your certification is received on registered email ID. So especially in the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, the quality certification is the fastest certifications and it's totally transparent and it's totally online. There will be no manual process. Only the online process is there. Yeah. Then the bronze quality certification, it is launched on the August 2019. The bronze quality certification, just like a pre-entry level certification, is less than NABH entry levels. Mainly focus on compression, user-friendly, evidence-based, digital certification, objective and balanced certification, which is mainly focused because we know that 75% of the small healthcare organization cannot reach to the NABH entry levels, especially in the tier 2 and tier 3. And that's why we launched the bronze quality certification to provide quality healthcare services to the ABPMJ beneficiaries. For the hospital that impaneled with the ABPMJ, that do not process any accreditation. Like if you're accredited from the NQAS, NABH or JCI, then you will go through the bronze quality certification. The bronze quality certification is the minimum standards, about 53 standards and 183 means of verification, which is mainly focused on the input, clinical services, supportive services, patient care and health outcomes. It's very simple and each and every guideline is totally pictorial, which is also available on our websites. So easy to understand because when we thinking for the quality certification, most of the times just हम लोग करते हैं कि कट एंड पेस्ट कर दो, बस गूगल में से किया कट एंड पेस्ट कर दिया, इंग्लिश अच्छी खासी इंग्लिश लिख दी. लेकिन कैन यू थिंकिंग over lower staff, especially which is working on the tier 2 and tier 3, how much experience in the English. And that's why we prepare the guideline for the bronze quality certification, silver quality certification, gold quality certification, totally pictorious without any language barrier. And it's the first guidelines where all the standard is totally pictorious guideline, which is very easy to understand. Any language, there will be no language barriers, and very easy process, and it's totally online. If you go for the bronze quality certification, just your hospitals registered on the portals, then the self-assessment is the main important things, then the information document submissions, then the fees is very minimum fees is there, because we know that in tier 2 and tier 3 small healthcare, there will no big hospitals, and that's why the minimum fees about 10,000 to 30,000. If your hospital is more than 1,000 bedded, then the 30,000. If your hospital is 50 to 100 bedded, then the 10,000 only. After the self-assessment, the desktop assessment is also there by the Quality Council of India assessors. After successful of the desktop assessment in the bronze quality certification, the on-site assessment is also available. But now, due to the COVID situations, this on-site assessment is also a virtual on-site assessment. It's totally online and virtual. There will no on-sites. Actually, it's a virtual assessment. If you successful virtual assessment, your certificate is received on your registered mail ID. So there will be no manual. If assessors say that your assessment is successful, then automatically your certificate is reached to your registered mail ID. So there will, if your hospital is well prepared, you will get this certificate within 25 days. Means this certificate is the fastest certificate which you received for the quality within 25 days. If your hospital is well prepared and your self-assessment is properly, then you will get the certificates within 25 days. It's mainly focused on the input, process, and outcomes. Same for the silver and gold quality certifications. The silver and gold quality certification, as I previously said, that silver is just a change of the nomenclatures of the NABH entry level and NABH certificates. If your hospital is already NABH certified, NABH entry level certified, or NABH certified, then go for the silver quality certification. In the silver quality certification, only 25 question is there, which is mainly focused on the ABPMJ awareness schemes, that your hospital is IC display, your Ayushman Mitra is trained, you have the nodal officer for the Ayushman Bharat, your patients benefits is there, your feedback of the patients is good, then you will get this quality certifications. And in the silver quality certification, again, the process for the silver and gold quality certification is very simple and it's the same. Only the gold quality certifications, if your hospital is full accredited or JCI, then go for the gold quality certification. The process is same like the login in the HEM portals. After the login, the self-assessment is very important. Self-assessment and give the evidence of the 25 questions properly online. Then the desktop assessment done by the qualified Quality Council of India assessors. After the successful desktop assessment, you will get these certificates on your registered mail ID. If your desktop assessment is not proper, then NC is raised. You will reply the NCs. But if your second NC or second time NC is not replied properly, you will again new registration is required, because only we give the 2 chance for the desktop assessment. If your 2 desktop assessment is not successful, then again your registrations is new after the 6 months. The bronze quality certification is both open for the both if your hospital is impaneled with Ayushman Bharat or not. If your hospital is impaneled, then it's okay. If your hospital is not impaneled with Ayushman Bharat, you will receive first bronze quality certification, and then if you want to impanel with the Ayushman Bharat, you will directly impanel with Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. The important things after this, the gold, silver, and bronze quality certification in the Ayushman Bharat scheme itself is mainly focused on the quality. When we impanel the hospitals, we have the criteria like the minimum 10 beds, minimum infrastructures, minimum scope of services. According to the scope of services, the manpower is available or not. According to the manpower and scope of services, instrument equipment is available or not. According to the services, the staff is well trained or not. So each and every checklist is available on our Ayushman Bharat Pradhan Mantri Jan Arogya Yojana websites. And not only for the empanelment, We are also focused on the standard treatment protocol guidelines also. We have the standard treatment protocol guidelines for all the process, which is mainly focused on the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Treatment is also standards, and that's why the standard environment, standard treatment, and satisfaction for the provider and his client, provider as well as the client is mainly focused on the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So as you see, the amount of like the bronze is the minimum quality standards, then the silver quality standards, and last but not least is the gold quality certifications. Gold is the topmost. If your hospital is NAVH full accredited or JCI, go for gold. If your hospital is NAVH entry level or NQAS, go for silver. If you do not have any quality certifications like the NQAS, NABH or JCI, you go for the bronze quality certification. After the bronze quality certification, if your hospital is already impaneled, you get the bronze quality certification. If your hospital is not impaneled, first you get the bronze quality certification, and then directly, if you want to impaneled, then direct to impaneled with the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Each and every detail is also available on websites. So we have the guidelines properly. It's totally pictorial. So my humble request to all participants, please visit these guidelines. And these guidelines, there will be no language barrier. It's totally, if your hospital staff want and see this guideline, it's very easy to understand the quality. And that's why I always say that quality coming from your heart. It's not by from the Google cut and paste and others pressers. It's from your heart, and it's very easy to understand. The simple definition जो आपको चाहिए वो दूसरों को दो, that means quality. So thank you very much, and thanks to Symbiosis. Thank you very much. If any questions, you are most welcome.
Thank you, sir, for enlightening us with your knowledge and experience, sir.
Yeah.
I now open the session and request our faculty members as well as the students to ask their doubts and questions to the speaker. You can also put up your questions in the chat box. I think we don't have any questions. If I receive any questions, I could email it to you and then you could answer them.
It is there in the chat box.
Oh, okay, sir. I'll just check. Okay. So, sir, there's a question from Dr. Akash Chaudhary. He asks, what are the opportunities for healthcare managers in public sector?
It's a good opportunity for the healthcare managers in the public health sector, because nowadays, after the COVID situations, the hospital management and healthcare management is very important things. And recently, we already over 38 posts we just launched, and on this 38 post, about more than 1,000 application is coming. So nowadays, it's really a good opportunity for the healthcare managers, for the health care services. And after this, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, we launched the National Digital Health Missions. And we are also thinking for the universal health coverage, because nowadays only the SECC data peoples are covered, but within few days, we all are covered under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So opportunity for the healthcare worker is much more.
So there's one more question from Tribarna. Sorry. She asks, so can we get any placement assistance from NHAI? Hello, sir. Am I audible?
Yeah, you are.
Okay. I think there's a network issue on his end.
Sanskrit will try to reconnect with him if he is lost. We are lost him.
Yes, sir.
He's reconnecting. Students could be ready with their questions, please.
तेरा किसी बोले जाए
बारी बारी से भेज दे रही हूँ क्योंकि हमें शायद ऑडिट के समय में इस पे कॉपी भी लगी।
Who is going to ask the question, please?
Tribarna. Tribarna, could you please unmute and ask your question, please?
Hello, are me audible?
Yes, sir. Yes, sir.
Yes, sir. Welcome back, sir.
Well,
Thank you very much.
So there's a question from Tribarna. She asks, sir, can we get any placement assistance from NHAI?
NHA directly cannot take the placement. It's only coming through the GIZ, IQVIA, WHO, and the World Bank. Only the government officers, like the state government and central government, they will recruit on the deputations. We are also on taking the young professionals, which is directly taken by the NHA. But recently, I think all post is filled. But yes, if you want to apply on the interview, especially on this session internship, we will most welcome.
Thank you, sir.
Thank
you, sir.
you.
Any more questions?
sir, are there any plans of the government of India for national immunization in terms of COVID vaccination, sir? So, are the government of India is planning to vaccinate in terms of COVID as a national immunization program?
I think this question is just separate from this my topic.
Yes. Still, but being the part of the government,
100%, it's a part of the government, and government has also planned for the vaccinations. When we the coming the vaccinations, it's just like a priorities the healthcare workers and the comorbid beneficiaries, more than 60% of employee, more than 60 year of age beneficiaries. So according to the we will give the priorities.
Okay.
And recently it's come in this New Year's, not a division. But the special message for the mask, I think the distance and use the mask is the main preventive action for the COVID, rather than the vaccine and other things.
Thank you, sir.
Thank you.
Sanskriti, if we don't have questions, then we can propose the vote.
Yes, yes, sir, absolutely. So thank you, sir, for enlightening us with the knowledge and experience.
Yeah, thank you
And
very much.
now I request Ms. Gladys to propose the vote of thanks.
Thank you, Sanskruti. As we come to an end of the session, we express a sincere gratitude to Dr. G.